we'd like to welcome Patty Clark, Manager of Food and Nutrition Services for Norman Regional Health Services. Norman Regional Health System has partnered with Meals on Wheels of Norman to help provide meals to our ill, disabled, and senior members in the Norman community. For the past 42 years, we started out in 1972. We're interviewing Patty today to highlight Norman Regional Health System's commitment to the Norman community. Can you tell me a little bit about food and nutrition services at Norman Regional?
Well, we're a pretty typical acute care hospital. We provide food services to the patients, the cafeteria, do a lot of catering. We also provide food through Inspirations, Meals on Wheels, and Food for Friends. And our registered dietitians see the inpatients and provide clinical care for them. We did start partnering with Meals on Wheels in 1983, and at that time we provided about 15 meals per day. And now we're up to 250 to 300 meals a day. We do provide special diets for clients, and regular food also.
Okay, why is it important for the elderly to receive proper nutrition?
Well, malnutrition is a big issue with elderly people, whether it's caused by disease like cancer, poor eating habits, depression, or just the inability to obtain food. So it's very important that the elderly are nourished. If they're poorly nourished and they have an illness event, then it's hard for them to recover from that. It's important as you age that you make better choices. You need less food but more nutrients. So you need to look at quality, not quantity. You also need to have 30 minutes of exercise of some sort per day, whether it's walking, climbing up the stairs, dancing, anything like that, just to get you moving. There are some certain nutrients that are important to the elderly. Protein to maintain muscle mass and fight infection, calcium and vitamin D for bone health, fiber to stay regular and lower your risk for diabetes. Potassium may lower your risk for high blood pressure. As you age, you need fewer calories but more nutrients, so it's important that you make good choices. You need to focus on quality, not quantity. You need to eat better while eating less. It's important for elderly adults to have protein to maintain muscle mass and fight infections, calcium and vitamin D for bone health, fiber to stay regular and help lower your risk for heart disease and diabetes, and potassium may lower your risk for hypertension. Calorie needs for adults also are lower. 51 and over typically need anywhere from 18 to 2,000 calories a day depending upon your activity level.
That's some really good information, Patty, and I appreciate that. I am a little disappointed to hear that after 51 you need fewer calories, though. I'd also like to ask you, what are the latest trends in nutrition we should be paying attention to, and what are some of the fads that people should avoid?
Well, you always just need to have a variety of foods and eat properly. A lot of the trends that are going around, if it sounds too good to be true, it usually is. You should avoid diets that eliminate complete food groups, severely restrict your calories or your food choices. All of those are detrimental to your health. The big fad diets right now, gluten-free, unless you've been diagnosed by a physician that you have celiac disease or gluten sensitivity, you should not be following a gluten-free diet. That restricts grains, and grains have lots of added nutrients to them. They B vitamins, fiber, there's no need to restrict that if you don't have to. And then a lot of people are following the paleo diet. The paleo diet is healthy in some senses in that you eat a lot of raw fruits and vegetables, but then it also eliminates some grains and dairies and dairy products, so it also has issues there. Basically, the bottom line is you need to eat a variety of foods and eat in moderation.
That's good information. Thank you so much for sharing that. Can you tell us some of the other resources that Norman Regional has to offer seniors other than the Meals on Wheels program?
Well, we do have a program called Senior Vitality, which is a wellness program. Has educational series aimed at people 55 and older. It includes some walking programs, nutrition for healthy lifestyles, stroke prevention, heart health. We also are involved with the AARP driving course. Wealthy and Wise seminars, end of life, and other topics of interest for seniors. Then we have Silver Sneakers, which is an exercise program that is aimed at the senior population. We have Silver Splash, which is an aquatic fitness program. And we have Senior Yoga Chair, which is a chair-based yoga session. And then we are also involved with Inspirations, and that is an outpatient counseling service aimed at the senior adult population. And that's dealing with depressions, anxiety, other challenges that seniors would face.
Well, that sounds wonderful, and I know certainly for me and for Meals on Wheels, we are truly appreciative of everything that Norman Regional Health System does for our community and to make life better for our seniors.
Well,
thank you.
You're welcome, and we've enjoyed working with Meals on Wheels. I've been working with them for 23 years, and I've loved every moment of it. And it's a very good program.
Thank you.
You're welcome.